When you get a breast cancer diagnosis and you have children, one of the first things that concerns you is, how will you talk to your children about this? Should you talk to your children about this? And what I would say is, generally speaking, when you have a pretty good idea of what's going on before you head into treatment, it is important to help your children understand what's going to go on. You want to do it obviously in as non-alarming a way as you can, but being truthful enough that you aren't going to be hiding something. Kids have amazing radar. They will know that something is going on. And when you've told them nothing, they often imagine even worse than the reality is. So sit down. Often I think it's helpful to sit down with your oncologist, if need be with a mental health professional, and talk about what can you explain to the children that will be understandable to them, that will not be overly alarming to them, but that will help them understand that for some period of time, you may not be feeling well, and yes, you do have a diagnosis of breast cancer. I think this is something that spouses need to agree upon, find an agreement before you sit down and talk to the kids. But I think it is important to let children know in a way that is, not frightening about the future, but this is what it is, and you are taking care of it. You're going to do these treatments, and things will be basically okay. Obviously, no one can know 100% what's going to be and what's not, and that's what makes it difficult to talk to children. But I think giving them initial reassurance is very, very reasonable, and updating as you need to go.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.